So bacteria, they are either beneficial or it may be pathogenic, right? Either beneficial or pathogenic. We can classify the bacteria into two ways. Some bacteria which are causing infection to human being and causes diseases are called as pathogenic bacteria. These pathogenic bacteria emits toxins and it will affect our body. The bacteria spread through air and water. By inhaling the contaminated air or by sharing utensils or with the dresses with the infected person, we will get. Typhoid fever it has a test of Vidal test. With that we can confirm the typhoid fever. Bacterial resistance. See, if we get the bacterial disease, if we go for a doctor, he will just prescribe us erythromycin or then amoxicillin, ampicillin, like that. If we go on take into that, then what will happen? The bacteria will become resistant to that antibiotic. If an antibiotic is used too often to fight a specific bacterial infection, then what will happen? The bacteria may become resistant to the specific antibiotic. So, hence, if we use again and again, what will happen? The resistance, because of the resistance inbuilt, the bacteria will survive. Therefore, the bacterial disease will not be cured. That is what given in this. If an antibiotic is used too often to fight a specific bacterial infection, the bacteria may become resistant to specific antibiotic. Hence, the specific antibiotic can no longer be used to treat the bacterial infection. Some bacteria will develop resistance to the antibiotics. So, it will be difficult to be cured. Risk of bacterial resistance can be reduced by observing following steps. What are all the steps to be followed to avoid this bacterial resistance? Avoid using antibiotics to treat minor infection. We should not use antibiotic for minor infections. Do not use an antibiotic to treat viral infection. See, if you have a viral infection, then also if you take erythromycin or amoxicillin or ampicillin, then it will not be effective for common cold and flu. Always follow the prescription, and skipping of doses or failing to complete the prescription will allow antibiotic resistance to develop. If the doctor gives a medicine for 5 days, then we have to keep that for 5 days. And we have to drink the medicines. If not, what will happen? The bacteria will develop its resistance. Viral diseases. See, viral diseases. Viruses are not useful. They are only harmful. They are very small. They will live only in the host cell and they will reproduce there only, and they will be living in that cell alone. In a living cell alone, the viral cell will develop. So, viruses. See children, now we are seeing the bacterial diseases in human beings. The bacterial diseases, the first disease is shigellosis, bacillary dysentery. This is caused by the species Shigella species. Usually dysentery will affect intestine. So, the site of infection is intestine. Mode of transmission. The mode of transmission is through food, water, food and water contamination, or by fecus or fecal or oral route. The symptoms are abdominal pain, dehydration, blood and mucus in the stool. Then the next disease is called as bubonic plague or black death. The causative agent is Yersinia pestis. Site of infection is lymph nodes. So this Yersinia pestis will affect the lymph nodes. Mode of transmission is rat flea vector. This is called as Xenopsylla chiopis. Xenopsylla chiopis. The symptoms are fever, headache, swollen lymph nodes. As it is affecting the lymph node will be swollen. Diphtheria. Corynebacterium diphtheriae is the causative agent. The disease is called as diphtheria and it is caused by Corynebacterium diphtheriae. The larynx, skin, nasal and genital passage are affected. The mode of transmission is through droplet infection. The symptoms are fever, sore throat, hoarseness and difficulty in breathing. Cholera, Vibrio cholerae. Causative agent is Vibrio cholerae. Then the same dysentery. Cholera is related to dysentery. It will affect the intestine area. The same, the contaminated food and water, fecal or oral route. Then symptoms, dysentery, diarrhea and dehydration. So for cholera and shigellosis, the symptoms are same, mode of transmission are same and site of infection is also same. But the only difference is the name of the disease is shigellosis, called as bacillary dysentery, or the disease is cholera. The causative agent is Shigella species for shigellosis and Vibrio cholerae for cholera. Other than this, all the three are same. Tetanus. Tetanus is also called as lockjaw. It is caused by Clostridium tetani. The area of infection is spasm of muscles around our cheek. The infection, it is through wound infection. The contamination is through wound infection. See, if we get anything hit against us, if there is any wound with the blade or something else, then we will go to the doctor and he will inject ATS or tetanus toxoid TT, anti-tetanus serum ATS or tetanus toxoid TT. So it is through wound infection. It is the preventive measure. Rigidity of jaw muscles. The jaw muscles will become very rigid. The heartbeat will be increased. And the spasm of muscles of the jaw and face. Typhoid is also called as enteric fever. It is caused by Salmonella typhi. The area of infection is the intestine. The mode of infection is through contaminated food and water. So all the intestinal diseases are through contamination of food and water. You all know this well, right? The common symptoms are headache, abdominal discomfort, fever and diarrhea. Then pneumonia. Pneumonia is caused by Streptococcus pneumoniae. The area of infection is lungs. And the mode of transmission is droplet infection. If the person coughs near you, or if he or she spits the sputum, chali, in some places, from there the pneumonia will come and affect us. The common symptoms are fever, cough, painful breathing and brown sputum. The sputum will be brown in color. Then tuberculosis. Mycobacterium tuberculosis is the causative agent. This is also affect the lungs. And tuberculosis, TB, you all know this well, TB if we say, right? In India, more number of TB patients are there. The mode of infection is through droplet infection. It's the thick mucopurulent nasal discharge will be there.